Well, hello everyone, and a huge welcome back to my YouTube channel. I am so glad you're here. Last time, we learned about thyroid function tests. All right, so let's say the blood tests show a problem. The next question is, why? Why is this happening? And for that, we need to look for antibodies. It's like looking for the culprit's fingerprints at the scene of the crime. Most thyroid problems are autoimmune. That means the body's immune system gets confused and attacks its own thyroid. To confirm an underactive thyroid is caused by this, we look for thyroid peroxidase antibodies. If these are positive, it's like the immune system left its calling card. This also tells us the person is at a much higher risk of their mild thyroid problem becoming a full-blown one down the road. For the overactive thyroid, the main cause is Graves' disease. The fingerprint for this crime is TSH receptor antibodies. These antibodies are like fake orders that trick the thyroid into working overtime, nonstop. Finding these antibodies basically confirms the diagnosis. This test is also super important in pregnancy because these antibodies can cross the placenta and affect the baby. There's another antibody, thyroglobulin antibodies. Their main job is to be a party pooper. They interfere with another test called thyroglobulin, which is used to monitor for thyroid cancer recurrence. If these antibodies are there, the thyroglobulin test can't be trusted. It's like trying to have a serious conversation with someone while a clown is honking a horn right next to you. All right, speaking of thyroglobulin, that's the actual protein the thyroid makes. We don't use it to check out new lumps. Its one job is to be a tumor marker after someone has had thyroid cancer removed. If the level starts to rise, it might mean the cancer is coming back. The only other time we use it is to bust people who are secretly taking thyroid hormone when they don't need to. In that case, their thyroglobulin level will be low. It's a lie detector test for your thyroid. Okay, finally, let's talk lumps and bumps. Someone feels a nodule, or the doctor feels a goiter. What's the first thing we do? We get an ultrasound. It's completely harmless, uses sound waves, and gives us a beautiful black and white picture of the gland. The ultrasound tech or doctor looks at the features of any lumps. Is it filled with simple fluid? That's probably a simple cyst, which is benign. Does it have tiny white specks called microcalcifications? That's a red flag that makes us more suspicious for cancer. Does it have irregular borders? Another red flag. It helps us decide which lumps need a biopsy and which we can just leave alone. You might remember older TV shows where someone drinks a radioactive cocktail and then gets a scan. That's a radionuclide scan. We don't do that nearly as much anymore, but it's still really useful in one specific situation. If a patient has a low TSH and a nodule, the scan can tell us if that nodule is hot or hyperfunctioning. And here's the key takeaway. A hot nodule is almost never ever cancer, so it can save someone from getting an unnecessary biopsy. Pretty cool, right? Okay, finally, let's talk lumps and bumps. Someone feels a nodule, or the doctor feels a goiter. What's the first thing we do? We get an ultrasound. It's completely harmless, uses sound waves, and gives us a beautiful black and white picture of the gland. The ultrasound tech or doctor looks at the features of any lumps. Is it filled with simple fluid? That's probably a simple cyst, which is benign. Does it have tiny white specks called microcalcifications? That's a red flag that makes us more suspicious for cancer. Does it have irregular borders? Another red flag. It helps us decide which lumps need a biopsy and which we can just leave alone. So, to wrap it all up, TSH is the boss. We check free hormones to confirm. Antibodies are the fingerprints. Ultrasound is our camera for lumps, and radioactive scans are for special occasions. I hope that made sense and maybe even was a little bit fun. If it was, feel free to give this video a thumbs up and hit that subscribe button so you don't miss the next one. Let me know in the comments what other medical topics you'd like me to demystify. Thanks for watching, and I'll see you in the next video. Bye for now. Don't forget to like and subscribe and hit the bell icon.